Okay, hello everybody. My name is Misty Delgado and I'm here with Relivar Home Care and Olivity Care Advocates. I've got Krista Rolando. Hey Krista.
Hi everyone.
Our administrator. And today we're going to be interviewing Susan Blaney, a local and awesome counselor. Hi Susan.
Hello.
But before we get into questions with her, we want to thank everybody for joining us. These are our educational sessions, helping those of you trying to figure out, find solutions for an aging parent. And we do these typically one to two times per month. And what Relivar does is between Relivar and Olivity, we help families who are struggling, trying to figure out what to do with their parents. If it's needing home care, Relivar can provide home care services. If it's, advocacy, trying to understand the situation and find solutions to the situation, Olivity Care Advocates and our care managers can assist with that as well. So without further ado, Susan, we want to thank you so much for coming on to our Facebook Live session. You are a wealth of knowledge and really a truly expert in this industry. So today we're going to talk about what you do, which I would say is, would you basically say it's like counseling services, counseling?
It is counseling generally for older adults, but for people in their 50s and 60s also.
Okay. Just a question. So is it mostly that you have to be homebound for this or?
My service is based on going to people's homes because that's how I started out in my career in different positions, working with older adults who had difficulty getting out. And so when I started my counseling practice, that was my primary focus. I mean, it still is going to people's homes, but they don't have to be homebound in the sense of thinking about skilled home care like physical therapy, the criteria, for having a nurse and a physical therapist and all that. It's much looser. It's just for people who have difficulty getting out due to mobility issues, chronic illness. They're not driving any longer. And it's one less place for them to have to ask their adult kids to take them to. So,
which is helpful.
Yeah, well, and I think also for the older adult population, I think it's easier for them. Counseling isn't something that they grew up with for the most part. It's not in their repertoire. So I think it's a little less intimidating to have me come to them than to come to an office setting.
Absolutely. Now, would you say you have a specialty in the older adult population then?
Definitely. Geriatrics, yes. I would say chronic illness is probably right up there at the top. People who are learning to live with chronic illness, which unfortunately is something that can hit us younger in life, but often hits people who are older. So it's lifestyle changes that come into that, and depression and anxiety, which tag along with chronic illness. Chronic pain is an area that I deal with a great deal. And I'm sure there are other areas. My mind just went blank. But I guess the thing with the counseling with older adults, it's, many times they think, oh, I don't need counseling. I've never had any mental health issues. I'm not crazy, right? And it's really just to help people cope with the changes that they encounter during the aging process. And some of those things can cause depression and anxiety, maybe on a short-term basis, but it's a change to lifestyle. And there are a lot of losses as people get older, and that's difficult to cope with.
Yeah.
Do you also deal with their family members when you do counseling for them? or what does that look like?
For older adults, I do. And it's very much on an individual basis. A lot of people don't want their families involved. Sometimes I'm counseling with them because of their families,
Right. Yeah.
because of difficult relationships or things of that sort. And so then confidentiality is very important to them, and I absolutely uphold that. But for others that are, I would say, back to that illness, for instance, someone has had to have a hip replacement or knee replacement, and maybe things didn't go as they had hoped. And so their mobility isn't going to get back to where it had been. And so now we're looking at lifestyle changes. So it can be very helpful then to also talk to the adult daughter or son or niece or nephew, whomever is helping to oversee the care. So it's not so much that that's a part of the counseling relationship, but it's a part of what I do after the counseling session with some of these older adults to just try to help things along.
Makes sense.
Do they have to, how do they get your services? What does that look like? I want to consider a counselor or look at having one.
Yeah, again, there's a variety of different ways. I would say the most common referral that I receive is from a skilled home care agency. So someone has been discharged home either from the hospital or from a rehabilitation stay, and they have in-home physical therapy, speech therapy, and a social worker, that sort of thing. And I get a referral based on those services because the social worker, the nurse, the therapist have identified that this person is struggling with their home life now. And so they see counseling as something that could be beneficial. So that's probably the most common way. I also have a group of doctors, the Beaumont Geriatric Evaluation Center, who value counseling for their patients. And so I receive referrals directly from them, sometimes from psychiatrists who, as we know these days, don't do therapy as they once did. They're very good at medication management,
Right.
but not necessarily at listening to the client's stories. And so the psychiatrist will often tell their client that they need to also find a therapist. With any luck, the psychiatrist helps them do that.
Yeah.
So those are the most common ways, but I would say, as I've been doing this on my own in private practice for 19 years, and when I started out, those were the primary ways that I receive referrals. These days, people go online and look for a counselor, and so they might just put in looking for therapy, and it will clue them into the Psychology Today therapy finder, and I'm on that. They can read about my services there and link with me. They can find me on LinkedIn. So they would put in their city, or they put in geriatric counselor, and I pop up for all of those things, as do other counselors in the area.
Yeah, that somebody showed me that website a couple months ago. That's a fantastic website. I'm glad, that we have that as a resource, because I know your coverage area is limited, as with most people's.
Right. For the home visits, it's I try to limit to South Oakland and Macomb counties, and the Grosse Points. But there are other in-home counselors that I meet with monthly. And so we refer back and forth to each other because everybody has a little different geographic area. But with opening it up to them finding me on Psychology Today or LinkedIn, along with that and the public health emergency, video counseling has become a part of my practice. I never thought I would do that, but But we all learned how. So,
Yeah.
so that's something that I continue. And so I find that and when I say younger people, I'm saying adults in their 50s, 60s, 70s, they're they choose the video counseling for a variety of reasons. Sometimes some of them they're still very nervous about COVID and about being out in the world, and some of them are immune compromised, so they really value the video appointments. And some of them are out of my geographic area, but they chose me because I work with a lot of people with chronic illness, pain management, some of the topics that I hit. And so they choose to do the video appointments because I can't travel to them.
Yeah, I mean, you work with many, many of our clients, and I know we've collaborated with clients together, and that what you have done for them has been great. Very supportive. We've seen improvements with them. You know, we've seen situations where you've worked with them for a longer period of time or a shorter period of time, but they always improved, you know.
Well, that's nice to hear, and it's always rewarding when my clients say, I think we can take a break now because things are going so much better.
Right.
So that's great. I mean, the short-term counseling is that's wonderful. That's very rewarding for all involved. But then, of course, I have clients that I have had for all the years that I've been doing this. And their situations, all we can do is try to manage things, from week to week, things for whatever reason, either health or income or just their basic makeup. Things aren't going to get a lot better.
Sure.
So,
Yeah.
They work on coping.
Yeah, I mean, just the idea, especially through COVID, of being alone and the loneliness and having somebody to confide in is just tremendous.
We all saw such changes during COVID, and certainly my ongoing clients. I started talking with them on video, or some of them, of course, couldn't do video, didn't have the means to do it, and families couldn't get to them many times to help. So we, fortunately, Medicare and some of the insurances allowed for just telephone counseling. And they're still doing that. I don't know if that'll always continue, but at least for now, we're able to do that through the insurance. And yeah, people that I was seeing every other week or sometimes every 3 weeks, all of a sudden, everybody seemed to want to do weekly sessions.
Yeah.
So I was glad that I was available to be able to do that for them. And those who were suffering depression or anxiety on a good day, of course, those things just spiked during the whole public health service. It was difficult for all of us. And some people are still reeling from it.
Absolutely, especially with this current bout going through.
Absolutely.
Most of the communities that I'm going into have it again. So
yeah, and I'm finding that also.
Yeah, it's changed life as people know it. And then that's really tough, especially when you're an older adult, or you're in a facility and all of a sudden everything's completely different and opposite from what you're used to.
Yes.
That's really hard to deal with.
Yeah. We talk about how, the benefits of moving into some of these retirement communities, senior housing, is the socialization and, eating in the dining room and having activities right there. And when all of that stopped, it was very, very difficult.
yeah, and your four walls just got smaller, and it's just, you can't go out without a mask. I would have to say, like, one of my clients, I put a mask on him, an N95 mask, and I seen his oxygen go down significantly just from wearing the mask. He could hardly walk, so people didn't really talk about that and the difficulty, with wearing, just the physical difficulty of wearing the mask itself. But
Sure. And all the people that are on oxygen at home and having to wear a mask on top of that.
Right.
Yes, it's a suffocating feeling.
Right. So do you feel like you help with that loneliness in addition to the like chronic pain and depression and anxiety?
I do. I mean, unfortunately I have clients who really don't see anyone else. I mean, not all older adults have families or friends or are linked, to community groups. So some of them are just simply home alone. So yeah, I'm sometimes the only person that they have contact with, or it's me and the Meals on Wheels delivery person.
Right. Yeah.
So
if they do have family, Susan, and that family member's wondering like, gosh, I mean, how would I know if mom has chronic pain or depression or anxiety that could be treated through counseling? I mean, do you have some tips for them?
yes, I think the families seem to realize that something isn't right. They may not come up with counseling as the remedy right away, but if they're seeing their parent is not engaging like they once were, if they're not involved in some of the activities, even watching movies, reading a book like they used to, their sleep pattern might change, their eating might change, lack of appetite, or overindulging. And sometimes there are tears, and the adult child wonders why. So I guess that's where it goes sometimes to the physician or home care agency, because sometimes that's the first step if people aren't really aware of counseling and the benefits. So, and of course now they can go online and they can Google, what if my parent is having these symptoms? And counseling would be one of the things that would pop up for them.
Right.
So,
Right.
I guess it's just, and I think about some of my older adults who are in their 90s. And sometimes it was a very rocky start with counseling, regardless who suggested it to them, because it's the whole, well, there isn't anything wrong with me. I'm sad, but there's nothing wrong with me. And they many times will just see it as a character weakness that they're allowing counseling. So it's an education process in the beginning to help them understand that this is what I am, is just a supportive person to come in and to be able to hear their story. And sometimes, I mean, you don't change history, obviously, but sometimes being able to talk about things that have happened in the past that are now bothering them, or keeping them awake at night, or the things that are going on right now with their change in lifestyle, can just help them to move forward and to have better days. That's really what it's all about.
Right. Especially, I think when you're rounding that corner in your 90s, and many times I will say to the clients, I'll say, how much longer do you plan on living? And many times they have an answer. It'll be 100, it'll be 2 more years, or it won't be 2 more years, So when you're thinking it from that finite time frame, making that the best quality of life is so important.
Yeah.
Especially when their activity is limited, like you said, in a community, that what they're doing is so limited from the way they lived their lives before, active and going and driving and, doing all the things. So we have those those triggers that occur in life, like I lost my license, I can't drive anymore, I've just been moved to a community, and it seems like a continuous loss, but there's good things that can come out of that as well.
Exactly. So sometimes it's just helping them to refocus on some of the positives, because yes, many times they have become dependent in some ways, and that's not a good feeling for any of us. I mean, nobody wants that to happen, but the reality of life is that sometimes you need a little help. And so just learning to have a different focus and see the benefits of what some of the resources can do for them.
Yeah.
Can change things, change their outlook.
Right. It's interesting that you say that, because one of the clients I'm working with now on care management are having a very difficult time allowing their children to help them. And they got, two girls from, they're remarried. So they got two girls on each side of the family, and they're all four women are very strong, and they want to help. And I just keep saying, it provides fuel there for them too. They enjoy out of their heart being able to give, if you can just receive, because it is hard for us to kind of receive and allow people to help us.
Yeah, a lot of older adults, I've noticed, think that they're a burden, automatically, they're worried about telling their kids things or their family members things because they don't want them to worry about them. And a lot of times in reality, those family members just need to know so that they can help.
Well, that's very true. I think that the role reversal that happens sometimes is very, very difficult. And actually that is sometimes when I refer to you.
Yep.
Because sometimes it just doesn't work for whatever the reason to have the adult kids be that key person. There might be long-standing conflict between the older adult and their daughter, or it might just be what you said, Krista, that they feel they're a burden, and so therefore they just keep saying everything's fine when things aren't fine, and they have needs that aren't being met. And so sometimes bringing in caregivers or a care manager is the perfect answer. And what I often hear when that happens, after the care manager, Misty, is there and meets with my client from the adult kids, it's like, but the care manager said everything that I've been trying to do for my mom. But now my mom thinks it's a great idea.
We see that happen a lot.
Many times. So I think care managers and home care can really be a bridge to getting the services that are really necessary and needed for many adults.
Yeah, thank you for that. And a lot of times, the family members do want to help, but they think they're helping, but like I had a older lady I was dealing with at home, and her daughter just kept arguing with her. Like the mom had dementia and the daughter just kept arguing. And so once we explained, it's better to go along with what she's saying than to, constantly be combating her. And as soon as she started doing that, she's like, oh, life got a lot easier,
Absolutely.
So, Susan, can you just, because not everybody understands what that role reversal is, would you mind explaining that a little bit?
Well, it is when the older adults starts to have needs that they can't take care of any longer. So it could be as simplistic as housekeeping and getting the laundry done, identifying when the clothes need to be washed because maybe eyesight, is failing, that sort of thing, meal preparation. And so the reversal is that now the daughter is doing the grocery shopping and maybe taking the clothes to her house and washing them and bringing them back, and maybe not hanging them up in exactly the right place where mom wants it to be.
Right.
So, I mean, it can be little things like that, but it causes friction. And then on a larger scale, many daughters and sons end up having to go to doctor appointments with their parent in order to understand what's going on, or if it's a chronic illness or even acute illness, and to understand the plan of care. And not all older adults want that, and sometimes doctors are guilty of, they're fast paced and they have a lot of patience. And so instead of explaining it to their patient like they would if the patient was the only one in the room, they look to the son or daughter and start rattling off all the different things that need to be done, and using their computer and everything, and the older adult feels left out.
Yeah.
So that used to happen, of course, when the older adult took that daughter to the hair doctor years ago.
Yeah.
Right.
So there you have the role reversal. But now we're dealing with adults, so it can be very difficult. And like Krista said, sometimes the adult kids either don't understand the aging process and the changes their parent is going through, or sometimes they're in denial about it.
Mhm.
We don't want to see our parent fail.
Yeah.
And so the approach that we use to communicate with them is not always the most pleasant. So it can turn into arguing, or mom, just be quiet. Let me take care of this. I'll just do it. I can do it faster and better. So again, that's where bringing in an outsider, a counselor, a care manager, a home care caregiver, they're going to approach the older adult differently, because we're not tied into that whole dynamic.
Absolutely. That's interesting that you say that, because one of the clients that we were working on recently drove their mom to Colorado, and we probably spent a good 15 minutes talking about, she had, dementia, mild cognitive impairment. And we were talked specifically about how to prepare for that, what, who should be there, who should be sitting with her, what kinds of things we should be doing to keep her engaged so that she didn't get agitated on the ride out there, and they did thank me afterwards, because they were like, we wouldn't have thought of doing
Right.
that. It's almost like, you're kind of planning a trip with your children, it's very similar situation, but this time it's mom, so.
Yes, yeah, that can be so challenging.
Yeah.
So
if somebody says, okay, I think this might be, helpful for my mom, do they just reach out to you directly, or?
they certainly can.
Okay.
Yes, that can just give me a call. And I would say most often it is a family member that ends up making the call. And so I get a little bit of background and talk with them about what they see, and what they think their parents' goals might be, if they have any. And sometimes they don't, and that's okay. Sometimes it's just that things aren't going well, and they feel like they need to talk with someone. So yes, it's just reaching out, and we get the process started. It's not a difficult startup. I guess the only stumbler might be insurance. And I'm a provider under Medicare, under standard Medicare, and most supplemental insurances pay the copay. But I check that out for them ahead of time if they would like me to. And I also accept the Medicare Advantage programs through a variety of insurances, Blue Cross plus Blue and Humana, Aetna, United Health. So generally insurance will pay for the counseling sessions.
Well, that's fantastic, because one of the, we're looking at the aging population finding reasons for not doing it. And if they have to pay out of pocket, they will hang their hat on that one right away.
Right.
But if you take that off the table, then, if we could just spend a couple of minutes on it, because, we've ran into that too, where people are like, oh no, I don't need counseling. I don't need any help. Just like what you said, do you have any tips for, us and the general public to say this is the best way to approach it with your loved one?
Well, guess what I always tell them is that, this is just something that we can try. It's one resource that's available to you. It's supportive counseling, and sometimes they don't play up the counseling part of it. This is an individual who's going to come in and talk to you, Mom, and see if we can just make things go a little bit easier for you, find some different ways to cope and think about what's happening. And I always let the person know that, they're really in the driver's seat. They always are. This isn't something that's mandatory. I suggest that we try it a couple of times, assuming they let me stay through the first session, and usually they do. To come back a few times, and we'll just talk about it each time, and I'll get their input. Do they feel that this is useful? If they don't, there's no long-term commitment. And that seems to lower the apprehension right there. And usually an adult child can present it that way and get their parent to accept. So many times some of the most reluctant clients are the ones that don't want to let go and just want to continue the process. So yeah, I think also making sure that sometimes they have a vision sometimes of what counseling is, and so they think psychiatrist and going back over my history and dredge up all kinds of old things, and that does not need to be a part of it. It can be, for some people it's what they want, but it certainly doesn't need to be.
Right.
I get what I would call a snapshot history the first time. Where did they come from? Where did they grow up? What did their folks do? Their siblings, their marital situation, kids, grandkids, all of that, and go over their health status and what's been going on and who their doctors are. And so the first time, it's just really informational, and also about what's happening right now, and why I was called in, and how we might address whatever it is. And if they want to have someone with them for that first session, I support that. I think sometimes, especially when I'm going into the home, they don't know me. So sometimes it's more comfortable to have someone there with them, if they prefer. So, and then we can go from there.
Got it. And now if they call you and you don't cover their area, you can refer them out to someone else then?
Mm-hmm. Yep. I think there are 8 of us in a group that meet once a month. And like I said, we share clients back and forth, try to get them into the right geographic area. But usually there is someone else who can handle it.
And those sessions, how long are the sessions when you're with the person?
The first time, it's generally an hour. And the second session also. might be that long. After that, it's generally about 45 minutes. And that's a Medicare guideline.
Okay. And do they usually last a certain number of weeks? I mean, what determines how long you go with providing care to them?
Well, as long as there are different things that we are working on and they see a benefit to meeting with me and talking about whatever their issues are, it can go on for a very long time. There isn't any particular limit. What I try to do is to meet with them on a weekly basis for the first month or so, and just because it just works better with continuity and them getting used to me and getting used to the process and everything. And then if, depending on their situation, we might back off to every other week after that, and then continue that way until they feel comfortable.
Got it. Okay.
Do they need a prescription from their doctor for it to go through their insurance, or they can just come on? Okay.
No, and I will, if they choose, I have them signed a release so that I can let their doctor know that we have started counseling sessions, but that's very individual, you know, whether they want me to do that or not.
Okay.
Got it. Anything else, Susan, that you feel like would be important for our Facebook Live folks to know about that geriatric counseling?
Yeah, I guess, I mean, we have focused on geriatric counseling, and that is the core of what I do, but I guess just, I think I mentioned that I also work with younger people, adults, always adults, who tend to find me because of chronic illness or pain management. And because those are issues that younger people obviously are dealing with through fibromyalgia or accident or, you know, many different things, rheumatoid arthritis. And so I have a whole group of people in those lower age groups in their 50s and 60s.
Okay.
That I also do the supportive counseling with.
Got it. All right. Well, thank you. Krista, any more questions on your end?
Nope, but I did want to say I put on the screen, I'm sure everybody can see that I have Susan's contact information up here. So if you know someone or if you yourself need some counseling and you would like to talk to Susan, you can reach out to her with her phone number on there. You could always reach out to us and we can get you in touch with her as well. And of course, if you have somebody that needs home care or care advocacy, you can reach out to us with the number on the screen here as well. And then we do have some upcoming topics that we're going to be discussing in our next Facebook Lives. We will post once we have dates and who our guests are for these topics. But there are some really interesting things that I know people are dealing with or struggling with regularly. And so we're going to be doing discharge planning, home safety, hoarding, dementia, and hospice all coming up soon.
All right, that's great. Thanks, everybody. Thanks for joining,
Okay.
Susan. Thank you for all your knowledge.
Oh, thank you for having me on.
All right,
Hi,
appreciate it.
Susan.
All right, bye-bye.
Bye-bye.